Hello, very good morning to all of you. Today we are going to discuss the case note of Caderina Piper, a 90-year-old woman who has been a patient of the Beecham Ambulatory Care Center, of which you are a charge nurse. So we are going to discuss the case note of this particular lady, a 90-year-old aged woman. Now, let's go ahead and see what's happening here from top to bottom. So we have the name, years 90 years. She's widowed. And from the social background, we can understand that she has very limited contacts with her relatives or neighbors or friends. So this is what we can see in the first part. So when we go ahead and see in detail, you can see something here. That's the discharge. Sorry. It was on 3rd of January 2018. And diagnosis post-traumatic stress disorder, PTSD, the diagnosis is. In addition, she has conditions, chronic conditions like pernicious anemia, osteoarthritis, and urinary incontinence. Now she is fully functional and fully independent. Even though she has these problems, she is fully functional and she is fully independent. And when we look into the medical history, you can see in October 2016, Ms. Piper's home was broken into and she was assaulted. The spelling is wrong here. It is assaulted here. It is assaulted. She was assaulted and robbed. She was very distressed, delusional, and confused. So we have understood her condition. What happened to her? What's the root cause of this PTSD is that her home was broken into in October 2016 and she was assaulted and she was robbed. Since then, she started having emotional backlashes such as distress, delusions, and confusions. In a period of 2 months, she got improved and she got discharged into a senior living building in a community in eastern Baltimore County. And this is what we can see. Now, as the months progressed in March 2017, she started going to work, but still she was seen emotionally ill. She was crying, depressed, and stressed about her new home. So she wants to move to a new senior housing unit. Now she left her house and now right now she is in a senior living building in eastern Baltimore County. Now she wants to move from that house to another senior housing unit because it would be on the bus route, making it easier to get around. Now, again, 9 months passed. In November 2017, after moving to the new facility, she understood, no, she came across some other problems, that psychotic symptoms, said that paranoia, and that was severe, and hallucination, that men and women are in her bed and calls others all those of the day. Now, this is as the psychiatric symptoms occurred, she got hospitalized. She was admitted to the psychiatric unit, and in about 2 weeks, she got discharged from the unit. And she has not taken a single drug, antipsychotic. Now, if you look further, After this particular history, after this brief history, now something relevant has happened. What you can see is after a week following her discharge from the psychiatric unit, paranoia, hallucinations reappeared. Now she was back to her apartment. After a week, in a week, she got her condition relapsed. And now we started the drugs. We commenced on haloperidol and the dosage is given. We started CBT, that is cognitive behavioral therapy, and we started exposure therapy too. So we have understood what has happened right now. Now, if you see further, you can see the nursing management. So this is what we have to do further for her. The medical management, we have discussed that we have given haloperidol, and we have started the haloperidol, and we provided her with CBT and exposure therapy. Now, as a nursing management, right now, we have taught her all these things. We have taught her these things. 1, 2, 3, 4, 5. You have a lot of things here. We encourage identification of ineffective coping mechanisms and consequences of that. We provided her adequate time to discuss and explore feelings. We should encourage acceptance and emotions. We should develop appropriate support systems. We should administer medications at order. These are the management which we started, and it has to be continued, and we have to give instructions to the nurse who is going to take care of this patient further. So these are the nursing management which we need to give as instructions to the nurse who is about to take care of Mrs. Piper. And we have, after the discharge, in case of any emergency, you have to call the emergency number. And in case she has oversleep or less sleep, you have to contact the doctor. So this is what we can see in the next part. Now, this is the main thing. So we have the writing task. We are going to write a discharge letter to Miss Bhavna Sandrine. And this is a charge nurse at Palmer Home Care Facility. And we have to inform the patient condition, that's about PTSD, and her medical and psychological needs. You have the medical needs. We have the psychological needs. So first of all, we need to give her idea what happened to her, what has the background, why she has got PTSD, and what medical therapy we have given, and which has to be continued, and what nursing management we started which has to be continued. So this is what we are going to write in this particular task. So let us go ahead and see the answer here. So as the discharge date is on 3rd January, it's on 3rd January 2018, Miss Bhavna Sandrine, charge nurse, Palmer Home Care Facility, Baltimore. Dear Sandrine, that's salutation, reference Mrs. Caderina Piper, aged 90. So we have gone with the preliminary things here. So let's go ahead with the purpose of this thing. Let's go with the purpose. For what I'm writing a discharge letter. I'm writing to request follow-up care for Mrs. Caderina Piper, who is being discharged to your facility today. That's on 3rd of January. She has been diagnosed with post-traumatic stress disorder. Many of my students ask me that she is not only affected by this particular condition, she has osteoporosis, she has anemia, and she has urinary incontinence. Why are you not including this thing in the purpose? Yes, of course, this is a primary concern, and this is a primary concern we are talking about. So we have to say that in the purpose. Of course, we need to include those things, the osteoporosis and anemia, incontinence of urine, as we can say it in the body paragraph of, we are not supposed to make the purpose paragraph as bigger. So I just want it in 2 sentences. What's relevant? We are going to discuss PTSD in the coming paragraphs. So that's why we have given PTSD here. Of course, we are going to discuss osteoporosis. We're going to discuss anemia. We're going to discuss the other thing there in the body paragraph, of course. So we have written a 2-sentence purpose. So we have said this is a discharge letter, and we have the request, we have the patient's name, and we have the condition. Now, Mrs. Piper was in a state of delusion and confusion since she was assaulted and robbed at her home in October 2016. So this is the starting date. In October 2016, she was assaulted and robbed, and since then she has had a delusion and confusion. So this is what we have said in the first particular sentence. Now, even though we have to brief it, we don't. We have a lot of 3 or 4 paragraphs there in the case notes, and we all we consolidated all those data into 1 paragraph, so it should, so that it should look brief. We are going to give a highlight that said, even though she started working and changed her accommodation twice, she had not recovered completely from her emotional blackout. She had, as she has got PTSD. She has not recovered from the blackouts. Now she tried to overcome the situation by changing her accommodation twice and started working, but still the condition was there. But by November 2017, almost a year later, she experienced the paranoia and hallucinations. I have to say severe paranoia and hallucinations, and was successfully treated in a psychiatric facilities for 2 weeks. Now, we do have the second question here. Some of our candidates have told that they asked, why don't we write without any drug use? Yes, with or without drug use. We are going to write about a drug later after a sentence. So we have said that she was admitted to a psychiatric unit and she was given treatment, and that treatment was successful. So I don't need to give a more detail. With drugs or without drugs is not relevant there. So that's not related to the request that we are making to a nurse. So we are just giving a brief idea what has happened. So I have said I need to say she was admitted to a psychiatric unit and she was treated successfully. Soon after, Mrs. Piper's return to the senior apartment, her psychotic symptoms relapsed, and hence she was commenced on haloperidol 0.025 to 1.0 mg daily. So this is what we can see here. Once she was discharged from the psychiatric facility to the accommodation facility which she was staying, her conditions relapsed. She had severe paranoia, she had hallucinations, and that's what we can see in the next sentence. She was also provided with cognitive behavioral therapy and exposure therapy. Now, we have said she got a treatment with a haloperidol. Other than the therapeutic treatment, we have drug treatment. We have the non-drug treatment, that's behavioral therapy, the cognitive behavioral therapy, and exposure therapy to decrease the intensity of PTSD. And that's what we have to understand from the first paragraph. I've given a brief idea of what has happened and what's the background information related to this condition, PTSD, and what treatment we have given. It's all consolidated in one paragraph. Now I have to give a brief idea of what she is. She's a widow and she has limited social relationships. Now we have said her conditions. Now additionally, she has pernicious anemia, osteoarthritis, and urinary incontinence. However, she is fully functional and is fully independent. Now, however, she is fully functional and independent. It means that though she has some problem, she has urinary incontinence, she has osteoarthritis, she has pernicious anemia, and she has the, the symptoms of psychosis. Though she has all these, she is fully independent, she's fully functional. This is what we have to give the picture to the nurse. And this is what I need from the nurse. It would be appreciated if you could encourage her to explore her feelings, identify ineffective coping mechanisms and consequences. Now, if you could encourage her to explore her feelings, so first of all, I've rearranged the discharge plan and nursing management here. So we have to we have a lot of things there. It's not possible to include all those data in the order which is given. So I have to make some changes, amendments in the structure of this paragraph. So the structure is amended. If you could encourage her to explore her feelings. So first of all, we need to encourage her, explore her feelings. Encourage her to identify ineffective coping mechanisms and consequences. Advise her to accept emotions and develop appropriate support for future therapies. Yes, so we have said a lot of things there. Now I have said that in addition to that, we have to maintain the medication complaints and call the emergency number if she hurt herself or others. Please intimate a doctor if she has any sleep disturbances. So this is what the requirement is. We have a lot of requirements there. Psychological needs, medical needs. This is the request that we are going to make to the nurse. She has a lot of psychological needs. She has a lot of medical needs. So that's what we have concluded in the last paragraph. Now, if you have any queries, please do not hesitate to contact me, or sincerely, because the name is given, Charge Nurse, Beach Ambulatory Care Center. And that's how the letter is written. Thank you for listening. Have a nice day.